Managing Care in Secondary and Tertiary Healthcare, Chapter 18. When individuals experience a self-care deficit, they access the services of healthcare professionals who has training in recognizing illness states and performing nursing interventions that in the process of reestablishing health may have positive outcomes or negative side effects. Patients must be evaluated constantly to determine their needs and appropriate level of health care. As Oram discussed, Oram believed that individuals have self-care independent care abilities or agencies that work together to meet regulatory functioning and developmental needs. At various times in life, a person will have a health care demand, either a self-care or a dependent care demand that exceeds his or her self-care agency. When the demand exceeds the self-care agency, the person has a self-care deficit. A self-care deficit can cause the person to need the care of specially trained healthcare professionals. The person enters the healthcare setting and engages in a collaborative relationship with the RN and other healthcare team members. The overall goal of nursing is to reestablish the healthcare agencies of the patient. The role of the acute care nurse has ended when the balance shifts away from the acute and then dependent care needs of the patient. The dependent care agency returns to the patient. Needs can be met by someone with other specific training beyond the acute care setting. Then we have the secondary healthcare systems. The secondary or acute healthcare uses principles of health restoration and health maintenance. Secondary care is basically when a need is specialized around the clock, nursing care is provided. Secondary treatment entails prevention of complicating disease, adverse effects, and prolonged disability through early diagnosis and treatment. The tertiary level of prevention entails rehabilitation in the event of disfigurement and disability. It involves health promotion and health maintenance. The outcome priority is to ensure that the patient regains or attains as much independence as possible. This is a theoretical framework for primary, secondary, and tertiary care model provided by your textbook. So let's look at consequence. Any significant response to or effect of an intervention. So basically the outcome is the expected consequence of an intervention and can be measured. And a side effect or adverse effect is an unexpected consequence of an intervention. Okay, so let's do a practice question. A patient had a stroke and has a speech disability. The nurse makes a referral to a speech therapist per the physician's orders. Which level of prevention is the nurse using? Is it primary, secondary, tertiary, or quaternary? I bet you know the answer to this one. It is number 3, tertiary. Rehabilitation is in the event of disfigurement and disability at this level of prevention. The RN manager of care is responsible for assessing the patient's needs and responses to therapies as well as the influence of other mitigating factors. So let's break down manager of care. We have the roles. The RN manages the nursing and collaborative plan of care for the patient. The manager of care must deal with unique problems that the acute care setting brings, such as environmental, spiritual, cultural, developmental, and social needs. Environmental influences such as previous negative healthcare experiences and exposure to infections are obstacles that the RN must overcome in order to provide quality patient care. Assigning experienced RNs or LPNs to the most high-risk patients and considering diagnoses when making bed assignments can reduce the negative effect of the environment. Prior experience can be a positive or negative influence. Orient the patient to the physical environment of the acute care setting, and implement continuous assessment of the patient's responses to the environment. The spiritual beliefs and needs of the patient must be considered and incorporated into the plan of care. There are spiritual needs and influences. You want to respect the patient's beliefs and honor all requests if possible. Patients may experience spiritual distress. Patients may need a referral. Respect the personal wishes and beliefs, and patients may require a spiritual guide or prayer. Because of the diversity of the U.S. population, cultural awareness is imperative in nursing care. Patients should be thoroughly assessed for cultural needs, which will then be integrated into the plan of care, thus making the patient much more invested in and comfortable with the plan of care. Create a culturally sensitive healing experience for your patient and associated family group. You can do this through communication, time orientation, spatial orientation, social organization, environmental control, and biologic variation considerations. Cultural strain can hinder healing. Then we have developmental needs and influences. Illnesses may interfere with the patient's developmental process. It causes concern and negatively influences the patient's recovery. Outcomes should focus on returning the patient to the highest possible level of functioning. Acute or chronic illness may threaten developmental task, and role strain is a possibility. And then we have social needs and influences. Social supports should be included in a patient's plan of care. Family and friends share the feelings and stressors of the patient during hospitalization. Keeping the family informed of the prognosis and progress should be a high priority for the nurse. Family access to the patient should be allowed as much as possible, as long as the visits are a source of comfort for the patient. The patient's social support may be interrupted. Support the family. Provide open, honest information about the hospitalized family member. Anticipate providing updates and other information without the family having to solicit it. Allow access to the patient when possible. And the patient's needs take priority. Visits may need to be limited. While providing safe and effective patient care, the RN must consider institutional restrictions and insurance limits and must manage resources efficiently. We will now discuss Resource Manager. There are things such as clinical pathways. The plan of care must fit the individual needs of the patient, but a clinical pathway helps keep treatment consistent and focused, thus minimizing cost and avoiding unnecessary interventions. This standardized care map defines nursing care, outcome criteria, and evaluation timeframes for specific disorders. It is designed to manage the resources of the healthcare agency as well as enable consistent, safe care for patients. RNs evaluate the effectiveness of the plan of care and the patient's progress toward discharge. RNs use collaboration to adjust the plan of care. Then we have discharge planning. In many facilities, discharge planning begins soon after admission. The RN, along with the healthcare team, must evaluate whether the patient can be discharged to care for himself or herself, or whether he or she needs additional assistance. The discharge orders should include information about the level of care needed. This requires assessing the patient's plan of care to determine whether the outcome criteria are met. Discharge teaching is a component. Occupational and physical therapy may be needed after discharge. The patient may need extended care. Then we have tertiary care referrals. Patients may be discharged to family care, home health care, or extended care to focus on assisting the patient back to the highest possible level of functioning. Hospice care, alternatively, is available for patients who have a short time to live. Comfort care and pain management are of the highest priority. We have the caseworker, which makes recommendations and assists in making arrangements for transfer to the facility chosen. They may refer to hospice, especially if they have 6 months or less to live. The priority of care is patient's peaceful and dignified death after living life. They may refer family to respite care. This is intended to offer the patient's family members time off from their dependent care duties. And then they may refer to home health care. This provides assistance to the patient and family for a short period of time after discharge to home. This concludes this lesson.